Hi everyone, this is a video to show you the conversion from a metal valve converting over to a stomadental disposable evacuation valve. This holds true for both the HVE, which is what we're going to show you today, which is the high volume, or it holds true for the saliva ejector, which is the smaller. Both would be transitioned or converted the exact same way. So the metal HVE valve is connected to a dental tubing via a tailpiece, and every valve can be removed by simply pulling it off, and you're left with a tailpiece. There are many different sizes of tailpieces on the market, and Stomadental created their own tailpieces for pretty much every dental chair that is in the US marketplace. They are different from the interior diameter, so different valves fit different diameters, and some are a little bit longer, some are shorter. Really depends on the make and model, but the majority of the valves on the marketplace will use the fittings that we are using. However, if you do not have that fit, you will need to change this out. So we'll show you how to do that. The fit of this tailpiece goes roughly an inch into the dental tubing. The best way to go about doing that is you can simply bend your tubing and find out where it kind of leaves off, and our suggestion would be to go even another inch below that. And the reason for that is when a dental tubing fits on top of a tailpiece, it expands, and also roughly an inch below where that tailpiece enters into the tubing, it actually builds up a tremendous amount of debris inside there. So we would suggest go roughly an inch below, right down here. Take a pair of scissors and simply snip off the old tailpiece. That tailpiece can be reconnected to the valve and then set aside. So now you're left with an empty dental tubing, which should be cleaned. If it's not, snip down a little bit further. And then you're also left with your new tailpiece design, and you're left with your new disposable valve designs. Best way to go about connecting a tailpiece is use some type of lubricant before you push it onto a tubing, because these fits are extremely tight. One of the best lubricants we found is using standard dish soap. So what I have is a little bit of dish soap, and all I'm going to do is rub it into the tailpiece itself. And then once I get it nice and covered, I can simply take that tubing, and it starts to slide right on, and then simply push it up as far as you can to where it becomes flush with the tailpiece. You can give it a little bit more right there. Once it's on, you may have to use a cloth to wipe it off. You get some of that dish soap on, and that's it. Now, if you take your new valve, you can simply snap them on, and now you converted. You went from using a traditional metal valve and converted over to disposable valves. These valves are going to be cleaner, they're going to be more efficient because you're not going to have a breakdown in parts, and they will be clean for every single patient. Hope this is helpful. Have a great day.